Prostate is a tiny walnut-sized gland present just below the bladder in men. Here you can see this is the bladder and this is the prostate gland. It produces fluid that makes up a part of semen. As you age, your prostate may get larger. BPH is when it gets large enough to cause problems. One point worth mentioning here that BPH is benign. This means it is not cancer nor does it lead to cancer. Still, BPH and cancer can happen at the same time. First, let's talk about the risk factors. There are many risk factors for BPH, but some people are at a higher risk, like men over the age of 50, as the risk of BPH rises with age. Men whose father had BPH, then overweight or obese people have higher risk. Men who don't stay active, and some men with erectile dysfunction. Now let's talk about the signs and symptoms of BPH. The first sign of benign prostatic hyperplasia is urinary frequency, which is a need to urinate frequently, especially during the night time. This occurs because the enlarged prostate glands puts pressure on the urethra, which makes it more difficult for urine to flow out of the bladder. As a result, the bladder contracts more frequently and men with BPH may feel a need to urinate frequently, even when the bladder is not completely full. It is one of the most common symptoms of BPH and can be a sign of the early stage of this condition. But urinary frequency can also be caused by other conditions such as urinary tract infections or bladder stones. The next common sign of benign prostatic hyperplasia is urgency, which is a strong and sudden urge to urinate even when the bladder is not full. This occurs because the enlarged prostate gland puts pressure on the urethra, making it more difficult for the urine to flow out of the bladder, which leads to a sense of urgency. Men with BPH may feel a need to urinate immediately and may be unable to delay urination for a long period of time. Urgency can lead to disruptive to daily life and can lead to incontinence or leakage of urine if the person is unable to reach the bathroom in time. It can also lead to anxiety and decreased quality of life. Urgency is a common symptom of BPH and can be a sign of the early stage of this condition. Again, it can also be caused by many other conditions such as urinary tract infection and bladder stones. The flow of urine may be weak or slow, especially in the early stages of urination. The weak urine stream can make it difficult to empty the bladder completely, leading to urinary retention. A weak urine stream can be frustrating and can lead to a feeling of incompletely emptying of the bladder. It can also increase the risk of urinary tract infection and bladder stones, as well as incontinence or leakage of urine. Interrupted urine flow is also an important sign of enlarged prostate. Urine flow may start and stop several times during urination. It indicates that your urethra is partially blocked. This problem can also be caused by infection or inflammation of the prostate, nervous system disorder, pelvic muscle problem, and sometimes due to side effects of surgery. Next important sign is inability to empty the bladder completely. Some men with BPH may not be able to completely empty their bladder, which can lead to urinary retention. Urine may leak out after urination, cause dribbling. This occurs because the enlarged prostate gland puts pressure on the urethra, making it more difficult for urine to flow out of the bladder. As a result, some men with BPH may experience dribbling after they have finished urinating. It feels like there is still urine left in the urethra. Dribbling can be a source of embarrassment and can lead to incontinence or leakage of urine. It can also increase the risk of skin irritation and urinary tract infection. Now again, worth repeating, BPH can increase the risk of urinary tract infections due to the accumulation of urine in the bladder. Sometimes men with BPH may experience pain or burning sensation while urinating. Next important sign is blood in urine. The presence of blood in urine, also known as hematuria, is a possible sign of benign prostatic hyperplasia. BPH can cause the prostate gland to put pressure on the urethra, which can cause irritation and inflammation in the urinary tract. This can lead to the presence of blood in the urine, which can range from light pink to deep red in color. In some cases, the presence of blood in urine may only be noticed after performing a urine test, as the amount of blood may be small and not visibly noticeable. However, in more severe cases, the blood in urine may be noticeable and accompanied by other symptoms, such as pain or discomfort during urination. But here, one thing you should keep in mind that blood in urine can be a sign of more severe underlying condition like prostate cancer. Last but not the least, BPH can also cause sexual problems, including erectile dysfunction. Now, it's important to note that not all men with BPH will experience all of these symptoms, and some men may have only a few symptoms. If you are experiencing any of these symptoms, it is important to see a doctor for evaluation and treatment. So that's all for today. Hope you find this video helpful. Don't forget to like, comment and subscribe the channel. Thanks.